Hey everybody, welcome to the Home Care Forum podcast with your hosts, Sasha Guillaume and Emina Poricanin, back live on YouTube, and got a lot to say. Emina, how is your week going?
Well, let's see. It's hump day, right? So I'll be glad when we're over this hump and that the
Yes.
countdown to the weekend is a little bit closer. But we do have a lot of updates for you today. In no particular order, let's talk about the New York State budget. This morning, New York State HCP held their debriefing and talked about what they perceive as the budget proposal problems. Interestingly, there's nothing in there about reversing the single statewide fiscal intermediary plan. If anything, in the media, there have been a lot of announcements about the state digging in. The state is saying that 12,000 people are already enrolled, the consumers are already enrolled. Meanwhile, there are a number of provider sources that are saying that's not correct. They're saying that the governor, PPL, and the Department of Health are putting out wrong numbers and that they're having a really hard time getting people to switch over. So, just to summarize, the budget is silent on the single statewide fiscal intermediary. The Assembly is strongly opposed to any measure to reverse the single statewide FI plan. Senator Rivera has reintroduced his bill for there to be a sort of a licensing type of process for selecting fiscal intermediaries. That faces an uphill battle. He is the New York State Senate, and so there may be some support there, but the Assembly, again, under the control of Hesty, who is a huge, huge 1199 puppet, are unlikely to support any such measure. So to the extent our listeners are hoping there is going to be a reversal of the single statewide FI plan, only such reversal will come through a forced action in the courts. Okay. There would have to be a judge who agrees with the advocates, the consumers, the personal assistants, the home care providers who are arguing for this to change course. And that type of litigation or court finding pressure would be the basis of reversing any legislation in this regard. Otherwise, this is going forward, folks. Unfortunately, this morning, one of my clients showed me a letter that they received from Village Care, terminating their contract with the last day of service being March 31st. This is the statutory deadline by which fiscal intermediaries who are currently operating as fiscal intermediaries have to cease doing business. So March 31st is the last day of service, and I expect that more contracts will start sending out these types of cancellation notices. Now, interestingly, there is no secret that PPL still does not have a single contract in place. There are rumors that they have reached a tentative deal with Anthem, but there's no contract in place and no agreement on rates. Again, this is just rumors, but there are rumors that Anthem will be getting a $28 per hour rate for CDPAP services, which would be a good rate, right? And maybe that's why they agreed to advance millions and millions of dollars to PPL for their first few payrolls, tit for tat, right? PPL, you take care of us with a good reimbursement rate, and we will advance you a lot of money so that you can fund your first few payrolls. But even with those rumors and this supposedly tentative agreement in place, no single MLTC has signed an agreement with PPL, not even Anthem. And so all of these people are being enrolled, supposedly 12,000 consumers who are supposed to be getting services at the latest April 1 on PPL's platform. They could move over sooner, but at the latest, services are going to start on April 1, and yet we don't have any contracts in place. But the governor is convinced this will go off without a hitch. Sasha, you look like you're dying
Yeah,
to.
yeah. Okay, so the question was, Amina, was the $28 rate that you're speaking of. Who is getting that $28 rate? I was a little bit confused there.
PPL's getting it, right? The
Okay.
PPL is now going to be the provider. And so that will be their reimbursement. Plus, they would be getting the PMPM.
Okay, perfect. All right, that's what I wanted to ensure. And I guess if that PMPM actually gets paid. because I still have yet to see it from some plans. So that's going to be an issue. But it's a better base for their PPM. So PMPM.
So, contract terminations are starting to come out, folks. There's a lot of confusion. Ads are going to start running as well, more so. PPL and the plans have started calling consumers. A lot of providers are confused about this. I get questions on this all the time. Are they allowed to do this? Absolutely, they're allowed to do that. And so if you want to keep these cases through March 31st, you need to be at the forefront of this as well and educating your consumers and PAs about when they have to actually move. Nothing stops you from speaking with your patients and your staff about what this actually means for them. You may have some questions from your office staff as well. If you have a really large CDPAP department, if you are just a CDPAP agency, then that's all that you have. Those employees may be wondering about their jobs come April 1. So you need to have those conversations internally. This train is moving at lightning pace. It may be a messy trip, but the governor, again, unless there is some court action stopping this, it's going to go forward as designed currently in the law. Okay, next, speaking about the budget and kind of returning to what's there, there's actually very little for home care. Aside from there being an omission of any mention of the single statewide FI, there's no appropriation for increasing the funding for home care operations. And so the associations representing licensed home care services agencies will be seeking additional funding in the budget for home care. As usual, there's increased funding for hospitals, nursing homes, and other community providers, nothing for home care. So there will be an affirmative request, at least by HCP, for $150 million to be put into home care. Now, I think some of the smarter legislators may ask why we have already funded home care, through managed long-term care. There is money in there for minimum wage, for wage parity, recruitment and retention, KeyVAP, et cetera. Why do we need an additional $150 million? The answer needs to be because the costs of administration have increased, like everything else. And on the same basis that you're increasing the funding for hospitals and nursing homes, you do need to increase it for home care as well. Now, interestingly, Blake Washington, the budget director for New York State, mentioned the other day that the fiscal proposal for the budget for Medicaid is 10% larger than the previous year. So think about this, folks, a little bit. We're bringing in PPL supposedly to save money on home care, billions of dollars, supposedly. And yet the governor's own proposal for Medicaid spending this coming year says that we're spending 10% more on Medicaid than we did the prior year. I have no idea what that 10% increase is based off of, perhaps because minimum wage has gone up. And minimum wage is in the Medicaid budget now, at least for home care workers, who are a huge, huge contingency of the workforce. So that needs to be mentioned. Whoever is planning to advocate and lobby on behalf of fiscal intermediaries, that needs to be mentioned, that the budget is not a balanced one at all. There is a proposal to start taxing MLTCs, just like there was last year. We'll see if that makes any progress. There was certainly an issue with it last year. I expect that the MLTC lobby will vehemently lobby against it. And like last year, they will probably be successful. There's also a proposal, like we've talked about, to eliminate wage parity from CDPAP. I anticipate that will not make it through either. And so the governor will need to cut something else to realize 200 million in savings that supposedly she would receive by cutting wage parity. So outside of that, there's actually very little that affects home care in the budget, which could be good or bad.
Yeah, I mean, I think it's bad. I mean, even where the one direct thing that affects is elimination of wage parity to the benefit of their pre-selected awardee. This is something that they could do for Elixir right now. like right now, you can cut the budget by X amount more. Actually, right? There's probably more PCAs than or equivalent, right? So let's say it's a match, is a draw that you have the same amount of PCAs as PAs. You can cut that out, save the budget. We've been advocating against this again. Okay, the union is not going to stand for it. It might not pass. At least make an effort, make it look like you're trying to cut the budget because there's another program with it. So why is it just the program that is for your pre-selected awarded single FI? That's another thing that the optics aren't good on that.
Forgive me, there are two things that I just remembered are in the budget that I want to mention for home care. So number one, Maximus's contract has been extended through 2026, the state Medicaid assessor. And then there is talk of capping enrollment for NHTD participants because that program is growing as well. You may remember from our previous podcast when we initially started talking about CDPAP and how that's going to force a lot of participants into these other programs, traditional like the NHTD, that the state would probably turn to somehow limiting those programs as well because the growth is not sustainable. We're seeing that right now with this discussion of the NHTD enrollment cap.
Now, how could you further cap a program that is already difficult to get into, right? And there are marketing restrictions. You're likely going to have to increase the level of need required for NHD, but this is if you increase the need for NHD, you need to be in a nursing home. Like
Yeah,
I don't see
it's more
where
expensive.
right. It's a bit so the service itself is for you have to have some ability to remain in the home to be able to benefit from this. But you're at the edge, right? Because you are looking at 24/7 care. And these are a lot of times existing patients. These aren't new to care.
Mm-hmm.
These are existing patients who have a need and they are already receiving 24/7 care through an MLTC, but they just have to get the wraparound service. Somebody make it make sense that I'm a owner of a provider of Lixa services. There are people way above my pay grade who should be able to see it. I'm sorry that they're not able to. This is not where you should be looking for the savings. Stop funding the hospitals every year. You can't print money, but but I mean, there are losses there, and I'm not saying that you shouldn't because everybody needs to go to the hospital, but there are people who need home care. You need to support them
Yeah,
fully.
yeah. Yeah, exactly. Agreed. And if you remember a few weeks ago, we talked about a law being passed that allows NHTD to stay out of managed care for one more year. So that's another measure that the state is actively looking at and will revisit in a year when it comes to this program. So there's all sorts of ways that they're trying to tackle the NHTD monster, the growing monster. And honestly, that program, I mean, we represent providers and we do applications for them to enter that program, it's really grown. It's not surprising that the state is reaching a point where they're trying to rein that in.
What,
Okay,
how, sorry, but how are you going to solve the problem by moving into the MLTC? You're still going to have to pay them, right? All you're going to do at that point is take money, reduce the reimbursement rate to the providers. That's it. The plans are still going to request what they request to
the
oversee this.
plans are so it's a capitated rate, right? What happens under managed care is that the unit cost significantly is reduced. I won't tell you what the rates are now for NHTD. They're published rates. Anybody can find them. I'm not going to mention them, but they are significantly better than managed care rates.
Right. No, 100%. But
Yeah.
and another thing, the MLTCs complain about utilization. Like, are you going to eliminate the penalty that they receive for overutilization, quote unquote? No, no. Like we as providers get dinged on that. Our rates suffer because of that because you take care of a patient for years who progressively gets worse. You're not being awarded for keeping them in their home for years, maintaining a level of care. Conversely, you're getting penalized. And then you're going to take a program that is full of people who are you're seeing the highest level of care where you actually reimburse for nursing and you're going that's going to go away, right? That's where it goes away. You're not paying for nursing anymore, then give it to the agencies to that's ridiculous. And what nurse is gonna like you're gonna have to pay them for the full time. You pay the nurse hourly for their services. It's not a per diem do an assessment supervision. So throw my hands like an old man. I don't know. I don't know how to fight this.
So,
Except in Albany.
value-based is a big topic, right? It's a buzzword, but everything that providers have told me that value-based metrics really have not resulted in higher rates. I mean, tell me if you disagree, but everybody I talk to says, yeah, we track all of this. We track falls, we track diabetes, medication, etc., discharges, and hospital entries. But I haven't heard of anybody actually monetarily benefiting from value-based factors. Is continuation in home care versus going into nursing home a factor in your value-based assessment? Because it should be, right? What you said at the beginning, we keep them out of nursing homes and hospitals for years and years. Why aren't we being rewarded for that?
Right. No,
It's not, right?
really
It's not a metric.
it's really upsetting. I mean, and which plans have a value-based program in place? Two, maybe. That's it. They're supposed to. They're required to have it. They don't. And I can't tell you how many times I saw our rate just progressively decrease as it came down to the date when we're going to see our final score. So we get you see it's like what has changed all year? You saw it rise, and then midway through you see it decrease, and oh yeah, you only get this amount. Oh, okay. I mean, I guess.
Mm.
Yeah, I think there's uh, the state sees the value in it. You don't have to cut that check, but you receive pretty good service, quote unquote, for half the year. But really, it's full year because it's really maybe it's arbitrary, right? You're getting dinged for uh, somebody not getting the flu shot following a pandemic where everybody is fatigued for getting
Mm.
shots. Okay, I guess. It's not realistic, these measures, and the money's just not going to fight. If you have to perform, or if they have a way that is unclear to you what the algorithm is, it's not objective. They can find any reason to not pay you the monies. Should you do things to improve your care? Yes, 100%. But either ask me to improve my care and don't dangle this incentive, or actually pay me for that, doing the work. That's it on that.
Okay, so yesterday everybody had a bit of a mini heart attack because the Medicaid portal for many states had gone down. Earlier in the day, the Trump administration announced that they would be putting a freeze on funding a lot of grant programs. But then later the same day, the Medicaid portal went down, and there were outlets reporting that the two were related, that the Trump administration was going to suspend payments to Medicaid dependent organizations until they reviewed the spending as part of their holistic review of the national spending, in particular with Medicaid. There were outlets also confirming that Social Security and Medicare was not affected. So there was a lot of confusion. The Attorney General for New York State filed a lawsuit. She pulled those papers really quickly, as did some of the other states. And by the end of the day, there was an injunction, a federal injunction prohibiting the Trump administration from moving forward with a funding freeze for these Medicaid dependent organizations like home care, like WIC programs, like senior citizens, impoverished senior citizens who depend on such funding for heating in the middle of winter, right? All of those individuals would have been affected. And if those organizations didn't receive their money, to provide those services, they would have had to lay people off. So there was quite a large panic. But by the end of the day, there was at least an order prohibiting the federal government from putting this freeze into effect. And then afterwards, there were announcements from the White House that supposedly there were technical issues with the Medicaid website being down, not that this was an intentional freeze. So who knows? But it doesn't look like the Trump administration will move forward with that, blaming it more on technical issues. And thank God we have that order in place, because as big as the CDPAP issue is to many of our listeners, this is going to wipe out everybody in home care, unless you're dependent on private pay solely, which is few and far between providers.
Yeah, I mean, I think one, there needs to be a delayed response to anything that comes out of the White House, right? It's just because things like this are going to happen, and the departments acted immediately, shutting down sites or what have you. I mean, if it sounds ludicrous, just take a beat, maybe. But I guess he has people as the heads of departments that maybe they're the ones who pulled the switch. But we really need to take a beat, because I think this is the game plan, right? Anything that comes out of there, the states are going to fight back. A judge is going to be, on standby, and they're going to everybody's going to react. Departments, attorney generals, and states. So I think maybe we can take this as a lesson. Now, I think we still are going to face an issue with this. This is, to me, sounds very Change Health-ish. You take a system offline and you try to get it back on, I doubt there's not going to be an issue. Let's see what happens by the end of this week. And then, but the next 3 weeks, I think are going to be key to see what effect this had downstream. So I'm not trying to cry wolf or what have you, but we really need to be prepared. I've been actively thinking about alternative sources of funding to cover a hiccup. I hope I'm wrong. I really do, but the past is prologue.
So yesterday I was reminded of the fact that I need to rejoin Twitter, or as it's now known as X, because, during the Trump administration 1.0, that's where your news comes from. It's not even the White House press office or Congress. It's, no, here's what I'm doing. So I was like, oh my God, I forgot about this world where I'm getting my information from social media. So I have to rejoin X at some point today. The second point I wanted to mention is that the governor's budget for New York State does not take into account this contingency of federal funding being out, right? And that's $93 billion that we can possibly lose as a state for Medicaid services if Trump decides to reform social services. Now, before the Republican Party was so gung-ho about illegal immigration, the number one peeve of the Republican Party, what was it, folks? Welfare. Welfare. Because what does the Republican Party stand for? Every man for him or herself. Mostly himself. That's the Republican Party. Every man for himself, right? How dare we help the poor, the impoverished, the single mothers, the crack babies, all of that. So the immigration stuff is definitely in the headlines right now, but let's forget about the core peeve of the Republican Party. And so how irresponsible is it of the governor to put forth a Medicaid budget that doesn't take into account what may very well be on the chopping block of this administration, which is social welfare programs, such as home care, right? Anyways, folks, you need to pay attention to this. I know we have all sorts of listeners on all sorts of political spectrums, but if you're a home care provider who bills Medicaid and you're a Republican, you have to appreciate this point. This party, which is now the majority in Congress as well, could very well cut off your lifeline for your business, at least. So call those people that you voted into office, right?
Okay. So I've had somebody who is a Trump voter come to me asking me, did I hear about this order from the White House? And essentially, I just started laughing. And I laughed for the next 2 hours. Like, listen, this is what you voted for. This is what he does. Not and it's part of the chaos that he does while he's doing something else that you're not looking over here. But as you stated, this has been the target of the Republican Party. So why are you surprised? And the conversations are, oh, this is how we make money. Yeah, but they don't care about that. And then they went back to the old refrain, trying to say what we were trying to do is we were trying to target the illegals who are receiving these benefits. You can't receive these benefits as undocumented. I mean, there are some refugees who come in who can benefit from this, but that's a legal path, right? But there's no distinction, right? So they will constantly go back to that refrain of these are undocumented and this justifies our actions, but it doesn't. And it's chaos. And well, so let me pivot to this, where Amina, you stated that you're gonna join Twitter again, which probably is where we're gonna get information about healthcare as Trump administration has stated its intent to leave the WHO, right? So where are you gonna get this information from about this H5N1 that's coming, or other programs that are for HIV and AIDS, tuberculosis, and all these things that we've been investing money in for years, and vaccines or treatments are on the way, but wholesale chaos, no funding, and we were only saved from the last time that the Trump administration intended to exit because Biden won. But by law, you're required to give a 1 year notice. He has 3 years left, and this is going to be the most impactful lame duck president ever, I believe. I think he refuses to be considered lame duck, and he's gonna be writing bills and signing executive orders on his last day of president. I get mark my words, that's gonna happen. He doesn't want to be a lame duck. He wants things done. He's gonna do it.
So I'm not going to put my political affiliation out there for the listeners, right? But, my family, we were refugees. I came to the US as a refugee. That was our status, right? And so I know those distinctions in status very well. There's a clear difference between undocumented, illegal, refugee, someone with an employment authorization card, green card, etc. And so when it comes to immigration, I'm definitely for legal immigration. But I will tell you this, no American is going to be working on farms, in the kitchens, Ubers, delivering food on Uber Eats. There's so much of our economy these days that depends on those workers. I think we're really what's that phrase? You are shooting yourself in the foot with a lot of these measures. I get it. You want to rein in the crime and the spending for folks who may be here illegally, but there has to be some balance that recognizes there is a significant workforce shortage in the US. And beyond the shortage, just no bodies. There are bodies who will refuse to do specific type of work that these folks do. So, or the nannies, right? Or the home health aides. I probably have at least a handful of cases each year where the client is evaluating whether to disclose and return money for services performed by undocumented home health aides. And all sorts of issues that come up, like whether it was fraudulent, whether that person really did go through the training and get a certificate, and the only issue is that they're undocumented, et cetera, et cetera. But there is a huge component of the society today, as we know it, that is performing these jobs that people born in this country will not do. And so I just wonder if the Trump administration reaches its goal of getting all of these people out, herding them up like cats, like they're planning to do, and getting them out, what happens to the rest of us? Who's going to pick the apples, right, in New York State on these farms? New York City is filled restaurants. Like you look behind the counter, who's washing the dishes, who's the bus boys, the bus gals, the coat rooms, etc. I don't know. I don't know what it looks like if the goal is achieved and all of these people are forced out. So let's just jump to our last topic of the day, and it has to do with the caring professionals lawsuit. So we haven't recorded since that decision came out. Earlier this week, a Long Island-based Supreme Court judge granted an application for a injunction that was filed by CDPAPs and caring professionals. The injunction is on its terms limited to those two entities and the members of CDPAPs. So the judge said, this is a very limited decision. The judge said that the Department of Health is restricted from penalizing and enforcing its memo directing FIs to disclose their PA and consumer information to MLTCs and PPL because of the potential for irreparable harm to these businesses and based on privacy considerations. Now, the decision is very limited. It's limited to members of CDPAPs, members as of the day that the decision was done. So don't go rushing to join CDPAPs. You ain't going to benefit from this. Sorry to say. However, is the DOH now going to have two buckets of folks, some of whom are being penalized and others who are not? Not so much. Unlikely. It's possible, but highly unlikely. So joining in the association at this point doesn't help you. Just stick it out. Also, the Attorney General, who is the attorney on behalf of New York State Department of Health, that was arguing this case and was trying to defeat the motion for the restraining order, said, oh, Judge, this is just a typical threat that we put in all of our guidance, right? The Department of Health always reserves the right to go after someone's Medicaid enrollment if they don't comply with our directives. And the judge was not having any of that. It was a very long hearing, actually, where the judge grilled the PPL attorney and the Attorney General, pushing them to explain how is it not a harm to require caring professionals in that case to disclose their list of patients and their list of personal assistants that they have cultivated and grown into a business all of these years. Good for the judge, because that's the crux of this case. That is what the state is forcing. And you've heard me say this before. This is trade secret, proprietary business information that every business has the right to protect, unless there's a stronger state interest or a regulation or a statute that requires the business to disclose it. Some guidance from the DOH that never has cited any authority. And to this day, in the oral arguments, the attorney did not cite any authority. The business interests in protecting the consumer information and the personnel information is stronger than this silly DOH memo saying, hey, to facilitate the transition, turn over your entire business. So the decision, again, in my opinion, is limited. To be clear, the decision does not say that the statewide FI efforts need to stop. So plans are free to share their information on consumers with PPL and with subcontractors / facilitators to get the transition going. The judge did not have before him the question of whether the state has a right to do this at all. So the decision strictly affects this question of whether the providers have to turn over the information, and it prohibits the state from taking any punitive action against providers who refuse to turn this information over. That's it. That's all the decision does. The state is still free to proceed with the statewide FI transition. What will happen next is that discovery will begin in the lawsuit. What does that mean? Discovery is a fishing expedition. It is a controlled fishing expedition, but expedition nonetheless. So the attorneys representing CDPAPs and caring professionals have a right to request and receive from New York State and PPL a number of documents. They have a right to issue subpoenas and get people to testify under oath. They have a right to fish for information which could be the basis of additional claims, such as, oh, there was a scheme between the DOH and PPL before the RFP ever came out, And so we're going to amend our complaint to add this corruption charge, basically. So that's good. It's good that the judge did not dismiss the case and allowed discovery to proceed. I would say more so than the declaration against New York State about penalties against providers who are not complying. I would say that the discovery piece is the bigger win here.
Well, before we close out, I just want to say congratulations to caring professionals and city panties. It is a great thing to see an association stand up and do something that results in something that benefits the industry, right? We know in the past we've talked about city panties. They do lean to the consumers, but yet they still advocate for the provider. So there are agency-specific associations that need to take this kind of action. They need to see, hey, this is what's happening. And the reaction by the industry at large is that, right? It's good on them. And I think if by some miracle we do survive this thing, CDPAP will be seen as a force in the industry, and a lot of providers are going to consider supporting them, right? If they're able to do something like this. So again, congratulations. It's some good news. Hopefully this sticks. It at least extends this effort into March. Advocacy Day for agencies is before that as a group, but smaller groups and individual providers are going up on their own and advocating through their lobbyists. So hope again that 90-10%, 90-10% that this thing gets overturned back to a strong 10%, and we'll see what happens moving forward. So that is it for us this week. This has been the Home Care Forum podcast with your hosts, Sasha Guillaume and Emina Poricanin. Have a good one.